Southwestern confirmed 2 North Texas cases of an Omicron variant. Now, this is just one of the major developments in the fight against COVID this week. Let's bring in Dr. David Winter from Baylor Scott White Health to talk a little bit more about this. Dr. Winter, good to see you this morning.
Good morning. Good to see you, Sonia.
Okay, can we start with this stealth variant that we're hearing about? What is the deal? What is this?
Yeah, it's a modification or actually a mutant of Omicron. They call it Omicron B2.B2. I don't know what that means, but we know a little bit about it. It's in most countries of the world in small amounts. It's in 4 states in America, including Texas. Just a few cases, 2 you said right there. We don't know enough about it except we found that it looks like it's about the same mildness. I like that word with Omicron. The number of hospitalizations is about the same as Omicron. We don't know yet if it's more transmissible or less. We'll find that out in time to come, see how fast it mutates. And we don't know yet how well it works with vaccines. So a lot of more information to come. It's brand new, so far not a big imprint, but we'll stay tuned about this, Sonia.
Yeah, I know right now, Dr. Winter, and we've talked about this before, but a lot of people are still wondering, well, what is up with all these breakthrough cases? Are the current vaccines protecting me against Delta, Omicron, the stealth variant, any of this stuff, all of this stuff? What do you tell your patients who are questioning this?
Yeah, a lot of studies out. CDC just came out this week and said we've actually looked at this in more detail, and if you've been vaccinated, fully vaccinated, there's an 82% less chance of requiring hospitalization. And if you get a booster, that goes to 97% less chance. So the vaccines work very, very well. Very well, Sonia.
I'm glad you mentioned boosters because I've even received emails from some of our viewers who say, Sonia, I've already gotten a 4th dose. At what point is that appropriate, especially if you're immunocompromised? What do you suggest to folks who are in that position?
Yes, right now we're saying, or the CDC is saying, that if you are immunocompromised, old or frail, have a lot of comorbidities, a lot of other medical conditions, you should consider getting a 4th booster, or at least a 2nd booster after J&J if that's what you've had before, and do that about 5 months after the 1st booster. That's if you've got the immunocompromised state and the other conditions. Otherwise, we're not really sure yet. Actually, they've delayed that information. Maybe we should get one in 6 months, maybe next year. So right now it's up in the air. Doesn't hurt to get it, but should we be getting that, the 4th vaccine? More information also to come about that.
So, future of vaccines. This is so interesting to me. You've got Moderna and Pfizer working on these Omicron-specific vaccines. What do you think about this?
Yeah, it's interesting. So we know the vaccines work very, very well now. We just talked about that. Do we need another one? Well, Pfizer and Moderna are already out in front of us. Pfizer on Tuesday announced they've got one in the works. Moderna said on Wednesday, we've got one that's specific for Omicron. And what they're going to do is they're going to take folks that have been vaccinated and put them in 2 groups. One will get a booster of the regular booster. One will get this new Omicron variant specific vaccine. We'll see what works better. So more information to come about that. Right now you can't get them, and I'm not sure actually that we need them right now.
Yeah, and study design is so important here. Those people aren't going to know which ones they get, so we'll have to wait and see what the results are. Okay, I want to talk quickly about treatments here, the therapeutics for COVID-19. What is available and what is on the horizon?
Yeah, it's a good question because we had 2 monoclonal antibodies we were using a lot, and we found out they don't really work well against Omicron. So the FDA has taken away their emergency use authorization. Those aren't on the market anymore. There's a new one out, sotrovimab, that does seem to work, but it's in very short supply. Pfizer and Merck have pills that are out, also in very short supply. All those seem to work, but right now, fortunately, if you've been vaccinated and healthy, you probably don't need it. Those folks actually usually well in my practice in 2, 3, or 4 days, and then they feel perfectly fine. But these other ones, they're not quite in good enough supply yet, so hopefully people are going to be careful, get vaccinated, or protect yourself, because we don't have good extra treatments right now, Sonia, but in the future, we should have plenty, I'm told.
Yeah, they are very hard to get as far as my experiences with people around me have gone. So, Dr. David Winter, thank you so much. Good to see you today.
Thank you. Good to see you.